Thank you for joining us. This is live with Miami's Community News, and I'm Michael Miller. Our special guest today is Nick Torres from Larkin Community Hospital. Nick, tell us what's been going on.
Hey, Mike. Well, as you know, yesterday there was a shooting in Utah, and Charlie Kirk unfortunately lost his life. And there was some media that went circulating around mentioning Larkin Community Hospital and a previous employee of our institution. We issued a statement basically saying that she is no longer affiliated with the hospital. We want to make it very clear that we do not condone or agree with anything that she said in her video or her statement. That is not the view of Larkin Community Hospital or the health system. Our condolences are extended to the Kirk family, and we want to reassure everyone that this is not the values, the mission, or the vision that Larkin Community Hospital or the health system holds.
So, the anesthesiologist, when did she leave the hospital?
So she completed her residency in 2018, and that was the last year of her.
That's 7 years ago.
Yeah, 7 years ago.
Been gone for 7 years.
Yes.
Haven't heard anything about her except for what came up on social media.
Until yesterday at around 5 o'clock when this video started circulating, I got my first message to look at this and had not heard. I didn't even know who she was beforehand. So before my time, but yeah, she did complete her residency with us. What I'm assuming happened is, and how we got affiliated here, when you're licensed by the state of Florida under the Department of Health, you have to add your patient location of practice on there. It's an optional choice. Most of the residents, when they apply for initial licensure, they put the hospital where they're working for. My assumption is that she has not updated it since she left Larkin, and it simply says still that Larkin, she has privileges at Larkin.
So that was an error. What was on that had her name, all right, her the type of work she did, and then it said affiliated with the hospital.
Correct.
And
yeah.
she's not been with the hospital for at least 7 years.
Has not, no. It's not even privileged with us to practice on the site.
So you want to discuss what has occurred?
Well, as a result of this, obviously there's been a pretty significant, I guess, I don't know how to use the word here, but reaction from the community. We've received over 1,000 phone calls to our front desk, another 1,000 to our human resources department. Our administration offices are ringing off the hook. Social media has been extremely hard pressing on Larkin, asking us, what are we doing about this? There's nothing we can do about it, right? She's no longer with us. We don't know where she went after she left us or where she is currently. I attempted to look for her online, and so did my media team, so we could reach out to her to ask her to remove the post, but we weren't able to find her actual Instagram tag or wherever this was posted from. Google, we've received a number of negative Google reviews, basically saying that how could we allow this person to work here with these values? What are we doing about this? Are you going to fire her? Even people making up stories that they were at the hospital, they saw her in the hospital, they were treated by her, which cannot be true because she has not worked with us for 7 years. So it's been quite an interesting, I want to say probably around 12 hours, a little bit less than 12 hours since all this began, maybe 18 hours now. But yeah, it's been challenging.
And so because somebody put that name, the affiliation there, it could, who knows who it was, but it was incorrect.
It was incorrect.
That was an old listing, at least 7 years.
Well, it's her current license for the department in the state of Florida says Larkin Community Hospital, that she's affiliated with Larkin, but she's not.
So with the state? With the state,
yes. So like I said, I can only surmise that she has not updated her licensure since she left Larkin.
So just to clarify, tell us again about hers, what was wrong with what was up there on the
post. Yeah, it just said that she is with Larkin Community Hospital. She's an anesthesiologist employed at Larkin Community Hospital. That is not true. She is not employed by, she's not affiliated with, she's not even credentialed with or has privileges with Larkin Community Hospital.
And again, our hearts go out to the Charlie Kirk family and to their friends and to the whole world about what occurred. Anything else you want to add?
No, I think that's pretty much it.
Okay.
Where Larkin's doing good things. We're very proud. We've made a lot of strides in the last couple of years. We want to make sure we stay at the forefront of this, being as transparent as possible and making sure that we are ahead of all these.
And tell us about some new things that happened at Larkin.
Most recently, we received a designation as a behavioral health teaching hospital. That is a designation given by the state of Florida, by ACA, which it was created to help merge and immerse education within the clinical setting so that providers leaving school, coming out of school, entering the workforce, already have a hospital experience, inpatient, outpatient experience, working in collaboration with the schools, with the hospitals, with the different levels within the state, within the Department of Children and Families, the school system, and just to make sure there's a well-rounded approach and that everything is wrapped together. So we're really proud to have achieved that designation. We're now working towards formalizing that. I've been speaking with DCF, with the University of South Florida. We partner with Nova University for this. What part of the designation requirements was that you partnered with a major teaching institution. We're the 5th hospital to get this in Florida. The first 4 were automatically approved when the legislation came out. So we applied the year we could, which was July of this year, and we were able to get the designation. So we're the 5th hospital.
You also reached another milestone in offering educational backgrounds, education, and tell us about that.
Sure. Well, our School of Nursing, we have an associate's, bachelor's, and master's level nursing program, all of which are accredited by APHES. We are now able to receive Title IV funds, which we should be able to start doing coming in January, well, spring semester of 26. So that's very exciting. We also have our medical school, the Larkin School of Medicine, which will be breaking ground probably in the next 2 years, but we are actively working on the plans for that. That's going to be down in Naranja. That'd be an osteopathic school of medicine. So very excited to hear that. Our Larkin University has a PA program that just started, physician assistant program that just started. We had over 2,000 applicants for that program, and unfortunately only 50 spots to fill.
2,000 and you got 50.
We got 50.
And tell us about the School of Pharmacology.
School of Pharmacy is doing great. So pharmacology, pharmacy, same thing. We are now, I think this is our 9th year with the School of Pharmacy, moving ahead great, swiftly. I mean, it's been a very...
I went to one of the graduations. I think it was the first one. I said, who are all these kids that are here?
I know.
Look at me and go, like youngsters. It seems to me they were 24, 25, 26 years old. I'm going, oh yeah, that's the next set there. Yeah. So tell us about the school down in Naranja.
Well, it's still in phases. We've been working on it for many years. We've had the land down there for a long time. We've now officially met all the requirements, so we can start actively planning. We have hired a dean, Ms. Paula Gregory, who will be heading off the school, getting it off the ground and getting everything moving together. So looking forward to
see the strides that Larkin Hospital, Larkin system has done is incredible. Tell us about the hospital that you have in Hialeah.
Yeah, so our Palm Springs campus, which is in Hialeah, Florida, has grown immensely. Most recently achieving comprehensive stroke certification, and it's an accredited certification. So they are a comprehensive stroke center in the center of Hialeah. So we're able to treat any number of patients. The volume there has grown significantly. In that area. Palm Springs is a 247 bed acute care hospital. We're working on adding some psychiatric beds, hopefully in the near future. Because there is quite a large influx of psychiatric patients that are Baker-acted and brought to the ER. That ER up there, yeah. And with the recent loss of psychiatric beds in the county, it seems it would be a good idea to add some more beds.
And you have some extra land that's
we have some around there. We're probably going to convert internally some of the space that's there as opposed to building a new structure. But, as far as growth plans go, maybe putting in an ambulatory surgical center on that same campus. It's a 10-acre campus. It's a beautiful, nice, large property. So we do have some.
What a growth! Where for folks that don't know, we're right down the street from Larkin Community Hospital in South Miami, and to see the growth and the team that has really put it together. My hat's off to whoever's leading that. I know you have something to do with it. I'm not quite sure what, but it's really extraordinary.
No, thank you. I appreciate that. I mean, the team that we have now between myself, Yoeli Hernandez, Anya Gonzalez, Tommy Michelle, Mark Early. I mean, we've really done some wonderful things in the last 3 to 4 years within the hospital. A completely different culture, very focused on education, very focused on clinical excellence. We both have leapfrog scores of A for the last, Larkin South here has been for the last almost 2 years, Palm Springs for the last year. Leapfrog, if you don't know, it basically shows clinical excellence. We're one of very few hospitals in the state of Florida that were able to achieve an A, and I think probably one of the only ones in South Florida that got it in the Miami-Dade area.
From Larkin Community Hospital. Thank you so much for joining us.
Thank you so much, Mike.
And we're going to sign up. We're going to look at this camera right over here.
Okay.
And this is what I'm going to say. Number one, thank you for joining us. Number two, the Millers now practice the Disney rule, which is when you hug someone, don't stop until they do. Have a great day.
Bye-bye.